Good afternoon, friends. I'm just having a fireside chat with Professor C. Palanivelu. So I would like to have some personal questions with him and to sort out his experience in this robotic and laparoscopic surgery. So first of all, sir, you were among the first early adopters of laparoscopic surgery in India. What inspired you to embrace this change, and what challenges did you face in convincing others in following this?
I think this is a very important thing that everyone has to know the way it came up. And initially, because of lack of medical facilities in my villages, I decided to become a doctor. But when I was doing MS general surgery, I saw cancers, particularly complex cancers such as esophagus, pancreas, not getting proper treatment going. Then I decided to become a specialist. So I later became a gastroenterologist and a cancer surgeon. Then wanted to promote the science, went to Coimbatore. I was in medical college and doing all sorts of cancer surgeries in gastrointestinal system. I was initially happy, but subsequently I realized the problems of the village people, particularly the farming communities. And most of the families are self-dependent, small farming, few acres land. Either one of them has to be there to look after the farm. For example, you want to do watering the field, or taking care of the children, or taking the care of the cattle and the cows. One of them has to be there. That's why, in spite of that reason, one of them will come to hospital, the other has to be there to look after. So, as a farmer, I realized the importance of faster recovery, making them to go to the field to look after. That was the reason. Even one of my own relatives, when I did a gastrectomy, that wife could not come and see him all the 12 days for gastric cancer operation in 90. That was the time I was thinking something how to help the farming community. Then I saw laparoscopic gallbladder video in a World Congress. Then I decided something, it is the way that we can do something, help the farming people to get faster recovery, go back to the routine work. That was the intention. I started laparoscopy going through. But as a new science when coming up, and naturally there will be always difficulties, different challenges you have to face with the people as well as the medical community. And particularly the people and making acceptance, there was no problem at all. Reason, I'm a MCH gastroenterology specialist, went to Coimbatore. In 90, I could make my own name before going for laparoscopic surgery, doing all of surgeries. And whichever that made across that area region, that I'm the trendsetter making in GI surgery. So when laparoscopy came introduced, starts with the gallbladder, appendix, hernia, and one by one procedure, including cancer, I could do it starting with the 91, going through all these years. By 98, I could do almost all cancer operation because patient acceptance is so good. And in fact, some of the procedure, the demand was from the public to do it more. For example, 92, when hernia laparoscopy was not the standard, a boy 24 years asking me, "Sir, can you treat my hernia through laparoscopic surgery?" Then I was forced to do it. Then subsequently I have to develop my own way, how to make it, because it is not proper description, technique to do it. So groin hernia or incisional hernia, in fact, I was so happy that I could do it, my own technique, and which will become the standard of care throughout the globe now. Similarly, many innovations we could to make it more effective. That background, my open experience and specialist, I could make it up. But other side of it, the challenges is, medical community initially when told laparoscopic surgery, like a family planning sterilization, you all know, those days before 90, family planning has been females done with the laparoscope. They call laparoscope means it's sterilization. That is keyhole. So through keyhole only. And they were surprised when say gallbladder operation appendix. How through keyhole these people are looking at operating? I think too difficult. It is not going to happen. Future. That is what the people thought, but they never realized it is videoscopic surgery. Videoscopic means more than open, you can see inside, wider view, magnification, clarity better. That we have to prove among the doctors community. Then I decided, okay, in fact, we did the Indian first workshop at Coimbatore, 91. And at that time only gallbladder. Subsequently 92 we are doing hernia appendix live. And 93 in fact ASI conference at Palanivelu Medical College, subsequently at Pondicherry ICS International College of Surgeons, where I showed gallbladder appendix hernia. Like every year I was demonstrating, inviting all the doctors to see. And in fact, 3-4 years I was only doing in hernia because people could not see throughout. When I demonstrated Vapi and Ahmedabad hernia, then only that surgeon who saw, then, oh, it looks good, they adopted it. So hernia is becoming a more popular, gallbladder. So 98, in fact, all the abdominal operation could do it. But still, there was resistance from the doctor saying, it is costly, difficult to perform. Particular example, you say hernia, oh, we can do it with a simple anesthesia, patient can go home one day. So that kind of negative feeling from the public, then and the doctors. Then what we did, in fact, when I showed hernia surgeries, my own experience at Rome World Congress, that even international, till that time there was resistance. And I was called to Argentina to demonstrate live in groin hernia. Subsequently, what I thought, prove in front of all doctors it is cheaper, cost effective, simply can be done. So I did in 2001, that is the year that entire community doctors coming acceptance. For example, I showed one day, I did a 34 hernias like a skin to skin live in front of 100 doctor surgeons and proving them it is a daycare, painless, patient can get back. So that way I proved. Another conference at Adair Cancer Hospital, I showed how the gastric cancer, how the esophageal cancer getting done by laparoscopic. That was the great eye-opener for the cancer surgeons to adopt minimal invasive surgery. It is not only that, even the internationally cancer was not popular till at the time, and esophagus, when I demonstrated at Bordeaux, France, that is the way it opened up internationally. I was called to Hong Kong, I was called to Manchester, UK, and different countries demonstrate how. So I have to convince, it had a lot of challenges. I think 2002, when Twin Tower in America collapsed, that made it, because Americans could not come for live surgery during our conference. I and Michael Eddy, only two faculty, demonstrating entire 3 days, all the type of operation, that is the inset for India to accept. I think it is a great challenge for us to say benefit for the entire community.
So you have become a pioneer in laparoscopic surgery, and you are an innovator, you are a visionary. How, did you ever think that artificial intelligence and robotic surgery will come into this field?
How can the laparoscopy itself took it longer time? I never thought. In fact, 1999, and that is a robotic surgery was talking about international meeting like a SAGES, American College. Then I made a surgeon from France to demonstrate laparoscopic robotic cholecystectomy from France to Coimbatore during our conference. But though it feasible shown, but none of the surgeons could show benefit over laparoscopic surgery. That's why I was also not keen for robotic, not interested. In fact, Giulio Notti, who is a great pioneer in robotic surgery, he published his robotic Whipple in the year 2003 itself. But my publication of Whipple came only in 2006. Because that time I was doing laparoscopy, he started doing robotic, but till 2010-11, robotic surgery could not prove benefit than laparoscope. So I was also not keen that it will go through. But one day when I happened to do in Holiday Institute, that my friend asked me, sir, can you do suturing? Why not you try yourself? When I was showing intracorporeally showing and a valve repair and cardiac, that day I thought Institute technology also enhance our capability. Then we got into robo. Now robo has come part of it. And nowadays, artificial intelligence again making us the perfection, everything. I think a long time I never thought robotic making it. Now it became a reality. Technology is also very important. That way I agree now. So initially not thought, now we have to go through robotic surgery.
Is there some conventional limitations in laparoscopy that could be overcome by robotic surgery? You think?
I'm sure technology is initially also, since I told you I'm not, but later there are classical differences between laparoscope and robo takes over laparoscope. For example, one, laparoscopic vision and laparoscopic vision is robotic vision is a stable imaging system. And here it is a surgeon controlled. There is no rotational movement, no jerky movements. It is a fixed, so surgeon have. Even camera control is by surgeon himself. So that is a stable platform. Is most important things to do it. Second, another thing is more important is and restrict movement. Restrict, see, by hand we can move any direction. We can fix it like left side, right side, up, down, anything they did. And robo, limited movements only up and down here. But robotic surgery is exactly like restrict movement. It has got an inductive effect. Inductive effect means like a hand, you can fix any angle to work. It is not like straight to like laparoscope. You can work like this, it will stay, you can turn, you can work. So this is a restrict inductive effect is much more wanted in surgery for enhanced dexterity. Third advantage is, tremor. In open surgery, instrument not controlled by anybody except surgeon, so instrument tremor will be there. Laparoscopy, abdominal wall fulcrum to extent helps, but still tremor exists. But robotic surgery, instruments are programmed such a way, no tremor. When no tremor and it is inductive effect, you can work with the very minute structures. Tubular structures, so for example hilum, or want to work with a lateral now, or narrow space, this very well works with that. That also another advantage. The fourth also is more important is 3D laparoscope also is there. One may claim both are 3D effect. No, laparoscopic 3D is different from robotic. Robotic is very important is you can work with a finer like a all round the structure. So lymphadenectomy, it is better than laparoscopy. Another advantage is also apart from radical cancer clearance, organ preservation. For example, spleen preserving distal pancreatectomy, robotic surgery has got more benefit. And if you want a lymphadenectomy along with the rectal-laryngeal now, between the aortic arch and this, a trachea, that robotic surgery is much safer than laparoscopic surgery. Similarly, also hilar dissection, everything. I think this is a very important aspect also to look at. Then also, surgical performance is enhanced. For example, it is a computer, digitalized. So it is even slightest movement we can enhance by this. So surgeon's capability performance is enhanced by robotic system. The another also advantage is there. A laparoscopic camera, if you move, the tip moves opposite side. But the fulcrum effect moves. When you move to right, it will move the left. But by practice, we learn. But still, the camera is under surgical assistance control. With his experience, if not adequate, tip will be, every movement will be there. But here, it is a well-controlled way. So that way, it is a classical benefit is there. And ergonomically, very comfortable. You can sit on work, less fatigue. So longer procedure, complex procedure, one can do very well with robotic surgery. And I think still it is all going, and future, this type of things will, complex surgery can made easy. That's why I think future, definitely robotic surgery outscores laparoscopic surgery.
All those benefits, what the surgeon gets through robotic surgery, you enumerated. When you come to the perspective of the patient, do you think early recovery and all those things which you had thought about in laparoscopic surgery, does it hold good for robotic surgery as well?
So initially I also thought like many, and robotic surgery is not going to make a difference in the patient point of view. Everybody used to say ergonomically comfort for surgeons. So surgeon's point of view is better than laparoscope. But later, and after 2015 on, I realized that there are benefits to robotic surgery. For example, if you take it, the robotic instrument movements are not like a laparoscopic movement. The tip programmed such a way it is moving so faster and going to enhance, and surgical performance also more. That way, the less pain. It has been reported by few articles likely to be. Second also is enhanced perfection, my 3D vision, clarity, bloodless also less for transfusion rate is much less in robotic surgery. And the third, cancer clearance also for going through the embryological fusion plane. lymph node clearance, and also has shown much better in robotic surgery than laparoscopic surgery. And finally, also, the more important is safety, working with the nerves at the lacrimal nerve in the esophageal cancer surgery, or hilar dissection in the liver, or in working at the pelvis for cancer rectum, presacral nerve and the plexus lateral nerve. There, this robotic surgery has got a benefit that less number of injury than the laparoscopic surgery. The another is the organ preservation. For example, if you take it preservation of the spleen during lateral pancreatectomy. So distal pancreatectomy, preservation of spleen also is better shown by robotic surgery. So that way, functional preservation has left more safety in terms of recurrent and also clearance. So these are the benefit that patient point of view also looks better. But indication wise, it is not that every procedure doing it. But if you properly selected a patient do robotic surgery, I think patient point of view it is outcome better. That is why I think in the future robotic surgeries it will have its effect.
Sir, as AI becomes increasingly integrated into healthcare, how do you envision operating rooms evolve over the next decade?
I think those days we are traveling, if we take a bullock car to bikes, a car, and now it is a flight. People even started flying rockets to go to different days. So like this, I think it is technology also more important. And the human being has got its own limitations and performance. So future, now you can see surgical precision, dexterity is much, much better than open to laparoscope to robotic surgery. And artificial has come. For example, if currently available robotic system, if you hold instruments slightly tighter, it tells you, doctor, you're holding instruments, relax. And not only that, and the simulation is part of the robotic system, and pre-operative workout and put a simulation during surgery itself will guide you and identifying structures, going correct plane or not, everything we can. And those days teachers used to hit and teach how to do it, but teachers may vary, one from each teachers are different. But here simulation, or if you work at robotic system, if you program in such a way, it is exactly the same way. It gives you how to do during surgery, it guides you and make it more safer. And not only that, and every procedure at the end, it tells you how much your performance. Is it 80% correct, or 70% or 50%, or even sometimes if you are not properly done, you will say you are not up to mark, you have to go and improve before coming to. That is become artificial intelligence and robotic surgery. I think future is going to be look like, and without technology, I think future surgery cannot. But one should feel that it is also improves our own performance. Only thing is we have to proper selection, proper adapt, proper learning is more important, and I think future is more important.
So, what would you advise the younger surgeons who are now venturing into the surgical field with the evolving technologies and the artificial intelligence that is coming? What is your takeaway message to the youngsters?
I think there's currently this technology is disturbing in us entire this. Whatever we thought we are going online, it is a double-edged weapon like. One side you have advantages, no doubt about it. The other side, look at there are dangerous way it is going it. So you future young surgeons have to learn the technology proper way, adapt to proper, and patient's perspective, whichever the good thing to adapt it. And unless until you know thoroughly about this technology, artificial intelligence have, otherwise we'll be in trouble in healthcare systems. And youngsters, it is not shortcut. You just, I'm technology, I can become a good surgeon. It is not. Technology may come on, but how the surgeon adapt to the situation, making it. So youngsters in future have to learn proper, understand the technology, select the proper technology to the individual patient. So patient should get the benefit. Ultimately our vision, for example, when I started laparoscopic surgery, I followed, there is no cutting corners of my principle of surgery. I followed the same. The vision making it perfect surgery to the patient, that means we have to be patient-oriented to technology. That means future surgeons should know which technology to adapt, how to use, how to make it more safer, much more important rather than taking, no, just like technology is going to make it. So no surgeon can be better and depend on technology alone unless until he learns proper way adapting it, and ultimate goal, patient should get the benefit and no shortcut. Everybody should put a great effort in taking that learning process, and when you know everything, you know the proper selection, then you become the good surgeon future. And even medical or surgical or any field, healthcare is go with knowingly, without knowingly. Today all of us are going with artificial intelligence. Even if you're making a letter writing or making it operation notes writing, or everywhere you look at, without knowing, already artificial intelligence is going with you. So that means the future artificial intelligence is going to be still more much. We don't know how it's going to be, but one must be sensible vision to look at which is good, going to help us in the proper sense. That is much more rather than adapting everything.
You had coined the term MASS, minimal access surgery for masses. So that the cost of the treatment comes down. What do you think, how robotic surgery will percolate down to the rural setup as well?
Yeah, exactly. And rural or urban, and there cannot be two different setup quality of care. And whatever the urban people are receiving, the same thing rural also people should receive it the same quality. But at the same time, when we wanted to give the quality, you have to adapt technology like what you meant, robotic surgery, artificial intelligence. That means we must adapt a technology, any robotic surgery or any artificial intelligence, we have to look at. And those days when watches came, quartz watches costing thousands, and within soon it was available in the streets. So it is a digital world. Digital world, there it's going to be a mass production. Initially the cost will be more, but prompt adaptation, the same technology, we can make it available to the rural people. Laparoscopic surgery when it came, it was, everybody said it is cost was more, high tech, high cost, only for the rich. But we could make it from the beginning, high tech, affordable cost, such a way developed cost-effective techniques. We made our own indigenous instruments, and today, Tanuk level laparoscopic surgery surgeons are doing extremely well. And Indian has shown to the world that cost of the treatment, high tech also can be just much more. Even Western countries looking at India, unbelievable way. Even Chinese initially thought, too costly, not suit to China, well looking at Japan, America. And when we visited our own Gem hospital, Coimbatore, they realized even the complex surgeries can be done so effectively and cost-effective manner. Then only 2003, I remember they mentioned the stage, Indian models to China, making this way. So even robotic surgery, they are taken one step more. Their indigenous product started, their own products started coming into the world. And yes, somewhere we have to adapt the technology, robotic system, and this same procedure, if we choose a proper indication, just for benign, simple diseases, one need not have this high-tech too much and surgical experience enough to do it, making it same quality of care. But there are complex operations where indication, robotic surgery will do patient benefit, that rural people also, middle class people should do it. That's why our association, Association Minimal Surgery of India, has commendable job making it and making propagation to the rural side. Today, mass to the masses, minimal access surgery, whether it is laparoscopic surgery, robotic surgery, or with artificial intelligence, has to reach the public people and so effectively. Unless until it reaches majority of the common community, we cannot call success. I am sure, and like laparoscopic surgery, in robotic surgery and artificial intelligence also, our Indian surgeons will do a much more commendable job, and it will take a lesson to the world that can be done well.
Sir, you actually demonstrated a wonderful two procedures this morning. So having experienced the AMS robotic platform today, how do you see next generation robotic systems can contribute to greater surgical precision, improved accessibility to robotic surgery, and better outcomes for the patient?
Yeah, I think it is better outcome can do the pure adopting new technology. That high technology has to be affordable to the common public. That is more important in this. So now we are able to get, initially we depended on only a single company for instrumentation. Now we have multiple companies have come, adapted robotic system in India. And in fact, Indians, surgeons, particularly space today to the world shown with the shortest time, cost-effective manner, surgeons can manipulate instrumentation at moon, and our Indian surgeon made it that possible. So similarly, now I'm looking at Indian scientists should go working one side technique, we have to improve it. The another side technology must adapt in India, and we have to make it indigenous way of Indians making new products. And now Make in India is a program promoted by the government of India, and today and all the states wanted to take it the healthcare system affordable, available to all the rural areas, and that way I think we have to make it our own systems to come, and there is an encouragement only from government, but unless until we adapt to the situation, very difficult. But now our Indian people are making a telesurgery, everything is possible. So soon I wish that we are going to have it, our Indian people, our own systems, make it up.
Thank you, sir. It was a wonderful chat, and you have enlightened us about your experience and your thoughts about how the future is. Thank you very much, sir.
Oh, thank you very much. Wish you all the best.